fever, shin bone, called shin bone fever because it characteristically causes fever and pain in the legs. This disease is also known as trench fever. It is a disease borne by body lice that was first recognized in the trenches of World War I, when it is estimated to have affected more than 1 million people in Russia and on the fronts in Europe. Trench fever was again a major problem in the military in World War I and is seen endemically in Mexico, Africa, Europe, and elsewhere. Urban trench fever occurs among homeless people and people with alcoholism today. Outbreaks have been documented, for example, in Seattle, Baltimore among injection drug users, Marseille, France and Burundi. The cause of trench fever is Bartonella quintana, also called Rickettsia quintana, an unusual bacterial organism that multiplies in the gut of the body louse. Transmission of the rickettsia to people can occur by rubbing infected louse feces into abraded scuffed skin or into the conjunctiva whites of the eyes. The disease is classically a 5-day fever. The onset of symptoms is sudden with high fever, severe headache, back pain and leg pain and a fleeting rash. Recovery takes a month or more. Relapses are common. It is now clear that, at least in its urban form among the homeless, trench fever can be associated with non-specific symptoms or no symptoms. New England Journal of Medicine 340, 184-189, 1999. The organism B. quintana that causes trench fever also has been found responsible for a disease called bacillary angiomatosis in people infected with HIV and for infection of the heart and great vessels, endocarditis with bloodstream infection. Trench fever is also called Bolivia fever, Quinton fever, 5-day fever, Muse fever. His disease, his Werner disease.